At CAMH, we are creating the design vision for the mental health hospital of the future. Phase 1C is comprised of the construction of 2 new buildings. One will include approximately 100 beds, an emergency department, and outpatient clinics that are geared to more acute level care. The other building has 110 inpatient beds and a large education and research focus.
CAMH started on this very, I would say, visionary approach in terms of a highly consultative process, both with clients and staff. At the same time, learning from what else is done in the world. So this whole notion of continuing learning of best practice, what is the most progressive approach out there? The whole consultation process is absolutely fundamental to how we as a design team provide planning and design solutions.
The main purpose of the design lab, or the mock space as we call it, is to make sure that we don't overlook a single detail. I give this tour probably at least once a week to various different groups of community members, family members, frontline staff members who will be working in the future space and some who will not, staff who might deliver services to the future space. And the reason we do it is to really hear from all of the stakeholders who have a vested interest, who will be providing care or receiving care in these spaces, to make sure that we are truly delivering a world-class facility. One of the things that we've chosen to change, in addition to the bed, is the window. You can see it's pretty big, and we wanted to meet the patient's desire to have access to fresh air. Our patients have told us that fresh air is a right. So patients have control over their own blind. They're able to open it and close it, and also raise and lower it as they wish.
I'm a peer support worker at CAMH, so all peer workers have had former experience in the system. Often when people get into a mental health hospital and they get into the rooms, they're not very inviting, they're not very comfortable, so this is a change and also allowed choice.
Having a personal space like a personal washroom, or just getting into your room at a certain period of time when you don't have to ask a staff to do these things, it empowers the individual, gives people independence as well.
The environments from when I started in 2002 have slowly evolved to offering the client more and more choice in their environment and more control. I think the clients really felt it was a place where you can see yourself getting well, discovering your potential, and discovering how you can go beyond your potential.
Our mock experience has enabled us to do a pretty comprehensive evaluation of everything we thought was a good idea. And we're changing about 40 different things associated with the patient bedroom in particular. The bottom line is for the facility to support the delivery of world-class recovery-based care. Form follows function. So the building supports care, care doesn't fit into the building. And we've been really, really careful about understanding how patients and staff and public need to flow through these buildings so that the buildings support that activity and not the other way around.